The coronavirus outbreak is reshaping the way we work, and Zoom video is helping to make that happen. Zoom video shares skyrocketing this week, more than 20% as the S&P plunged. On the other hand, I want to bring in Kelly Steckelberg, the CFO of Zoom Video now from San Jose. Kelly, thank you so much for joining us. So first of all, give us an idea just how much new activity you're seeing. I had my mom today asking me to Zoom. Talk to us about just what kind of growth you've seen in the last week.
Yeah, it's been a really amazing time to see how people are using new and unique opportunities for using Zoom. First of all, we've been focused on supporting the needs of schools. We are currently providing free services for K through 12 schools in 12 countries around the globe, as we're seeing students everywhere be impacted by the stay-at-home needs today. And then there's other really amazing and heartwarming human interest aspects to this as well. People like a 13-year-old in New York having his bar mitzvah via Zoom. And also we heard today about a CBS writer's room bringing up Zoom so that they could continue focusing on producing their TV show. So lots of opportunities around the globe for Zoom to be helping. And we're happy and grateful to be in this unique position to help people stay connected in this disrupted environment.
Can you give me any numbers? I mean, according to outside estimates, Zoom downloads doubled last week. Anything new for this week, as we're seeing not just businesses, but as you say, schools and consumers, people at home starting to use it?
Yeah, we aren't disclosing exactly those numbers, but what I can tell you is we have provided Zoom to over 25,000 K through 12 schools around the globe. So very happy to be able to enable them while they're all learning from home. And we're doing everything we can to ensure that anybody else that has a need for Zoom, that we're here for them.
So how much of a struggle is it to keep Zoom up and running, to deal with the demand, the bandwidth that it takes to keep all of this going? I mean, we've heard anecdotal stories about lines getting clogged or lines dropping, just I imagine because of the sheer volume of people on the service.
So we have 19 data centers around the globe, and these data centers have been built to operate at 50% of peak capacity, not even average capacity, but peak capacity. And in order to be able to be situated for a situation just like this. And they're architected so that if one of them is having a surge in traffic, it can share the load around the globe, around the other 18 data centers. And so what that has enabled us to do is to proactively be able to meet the demands and watch the traffic as it's coming and support even the increased usage that we've been seeing.
So are you seeing an uptick in conversion from free to paid users during this time?
It's really early to see and to say at this point in time. We have also, as you probably heard, lifted the 40-minute limit on our free product in China many weeks ago. And what we want to do is just ensure that anybody that has a need for the product is able to get it. And what we hope is this is an opportunity for people that hadn't used Zoom before. As you said, your mom is a perfect example of this, to get to experience it. We live on Zoom every single day, of course, in our company, but other companies, organizations, even individuals are seeing new opportunities for using it. And we hope that they continue to embrace it even after we go back to some sense of normalcy, that this becomes the way that people communicate. We really believe that video is the future of communications, and this is an opportunity for others to experience it the way that we do every day around the globe.
And quickly, you've talked about how doctors in China were using this to communicate with patients. Are you seeing any uptick in the use of Zoom in the U.S. healthcare sector or in Europe between doctors and patients?
We certainly have seen, as we've seen in EDU, we've also seen an uptick in healthcare as well. As you say, it provides a safe way for doctors to continue to communicate with patients and or other healthcare providers around the globe, doing it the way that I'm communicating with you from my home or from other safe environments without putting themselves at risk.